You will hear a discussion about a patient's discharge plan. So, Mrs. Carter is ready to be discharged today. Have you gone through the discharge checklist?
Yes, I have. I reviewed her medication regimen with her, checked her wound dressing, and provided post discharge instructions. She seems confident about managing, but she did have some questions.
What kind of question?
Well, mostly about her medication schedule. She was a little worried about remembering everything, so I gave her a printed timetable and went over it with her.
That's a really good approach. Did you also check whether she has someone at home to assist her?
Yes, her daughter will be staying with her for a few days. I also scheduled a follow up call in 2 days to check on her progress.
Excellent. And let's make sure she has a follow up appointment before she leaves. You will hear a conversation addressing a patient's fall risk.
Mr. Dawson had a near fall earlier while trying to get out of bed. I think we should reassess his mobility.
I agree. He's still weak from the surgery, so he may need more support. Let's conduct another mobility assessment today and adjust his care plan accordingly.
Should we use a walking frame for him? He seemed quite unsteady when I assisted him earlier.
Yes, at least until we're confident in his stability. I'd also recommend bed alarms and possibly physiotherapy sessions twice a day instead of just once.
Yeah, that sounds reasonable. I'll also inform the rest of the team so that everyone is always available to assist him when he needs to move.
Good. Let's document this and make sure his care plan is updated accordingly. You will hear a discussion between a dietitian and a doctor about managing a patient's diet.
The patient in room 4 has been struggling with nausea, so I've adjusted his diet to include lighter meals.
That makes sense. Has he been tolerating the changes?
Yes, but he's still not eating much. He mentioned feeling weak, which could be due to inadequate calorie intake.
That's concerning. Have we considered a nutritional supplement?
That's my next step. I was thinking of introducing a high protein liquid supplement between meals to boost his intake.
That sounds like a good plan. Let's monitor his intake over the next 24 hours and see if there's improvement. If not, we might need to explore other options like intravenous nutrition. You will hear a discussion between a pharmacist and a nurse discussing a medication adjustment. The patient's blood pressure remains high despite the current medication.
The doctor mentioned adjusting the dose. Did you receive the updated prescription?
Yes, we're increasing the dosage slightly. We'll need to monitor for side effects such as dizziness or fatigue.
I'll keep an eye on that and check his vitals more frequently. Should we also monitor his kidney function?
Oh, yeah, that's a good idea. Since he's on long term medication, we should do a renal function test in a week.
I'll add that to his chart and notify the doctor.
A manager and a receptionist are discussing on how to handle a patient complaint.
A patient was upset earlier because her appointment was delayed.
Oh, was it due to an emergency?
Yes, the doctor had to attend an urgent case, which pushed back the schedule. She was quite frustrated, but I explained the situation.
Did that help calm her down?
Well, somewhat. I apologized and offered her a later slot today, which she accepted, but she still seemed quite a bit annoyed.
That was the best approach. If she's still unhappy, let her know she can file a formal complaint and we'll review it. Also, let's see if we can improve communication for future delays. A surgeon and a nurse are preparing for a medical procedure. Is the patient prepped for the procedure?
Yes, she has fasted as required and her consent form is signed. She's a bit nervous, though.
That's understandable. Did she receive pre op counseling?
Yes, I went over what to expect with her, and the anesthesiologist also had a discussion with her earlier as well.
Good. Any concerns about anesthesia?
No known allergies, and her pre op tests were all clear. We've also ensured she has adequate pain management planned for after the procedure, too.
Excellent. I'll talk to her briefly before we begin to reassure her. And here are the answers. Don't forget to like, follow, and subscribe.